So today we're going to be running some cranial nerve tests today. So we're going to start with cranial nerve number 1. And if you could please close your right nostril for me and close your eyes as well. All right, perfect. And then just let me know what you smell. Okay, cool. And then could you now switch to your left nostril? Perfect. All right, thank you. Nice. All right, so now we're going to go on to cranial nerve testing number 2. We're going to do the accommodation test. So I'm going to start with this pen. I want you to track this pen with your eyes. All right. Good, good, good. Perfect. Okay, so for cranial nerves 3, 4, and 6, we're going to be doing the cardinal field gaze testing. So what I'm going to do is I'm going to make an H, and I want you to follow my finger. All right, and then I'm going to go back. Perfect. So for cranial nerve number 5, we're going to be doing the sensory test. So if you could please close your eyes for me. I'll pretend that this is a cotton swab. So for V1, we're going to test this area right here. Tell me if you feel anything. Perfect. And this side. All right. So for V2, we are going to go onto this area right here. And then on this side. And then for V3, oops. All right. So for cranial nerve number 7, we're going to do the facial muscle test. So I'm going to have you do make some faces. So can you make a happy face for me? Okay, now a sad face. I want you to squeeze your eyes as hard as you can, like closed. Perfect. Can you puff your cheeks? And then could you pucker up your lips? Great, thank you. So now we're going to move on to cranial nerve testing number 8. I'm going to do the finger rub test. So let me know if you can hear the finger rub, and then let me know when you stop hearing it. All right, then we're going to go into this side. Perfect. Okay, so for cranial nerve number 9, it's going to be a little unpleasant. We're going to do the gag reflex. So I'm going to have my example or tongue depressor, and then we're going to go on your tongue and then slowly go to the back. And then I want you to let me know if there's any pain or unusual discomfort. And then once you gag, of course, come back out. All right, so for cranial nerve number 10, I'm going to have you go and say ah for me. And then, so say ah. And then what I'm watching for is the uvula, and also to see if both sides of the soft palate rise equally, and it's good. So for cranial nerve test number 11, we're going to do the SCM test. So I'm going to put my hand on your cheek. If you could push against my cheek for me. If you could push your cheek against my hand. Yeah. And then this side. Perfect. Now we're going to do the trapezius test. So I'm going to push down on your shoulders and you push back up. Perfect. And then for the last cranial nerve, I'm going to have you stick your tongue out. Perfect. And I'm just looking for a deviation, which there wasn't. And that's it.